Hey, what's up, Dr. Chad with Energy Physio? Today, we're talking about how we really deal with pain in a very comprehensive way that ultimately allows us to achieve pain relief in a pretty dramatic way in 3 visits or less for, I don't know, maybe 90% of our patients. We do have some that linger past that 3 visit mark. They have different types of pain that are a little more nuanced, and they challenge our creativity a little bit more. But ultimately, when people leave energy, the pain relief they experience is significant. And the way we've been able to systematize that has allowed us to just do it over and over and over and over. So, we're not coming from a place of, right or wrong, or certain treatment styles are better or worse or ineffective or really effective. Really, it's just like, this is what we've been doing and it's been working really well. So we just want to share that. Whether, you're a patient looking for the next level of care, or maybe you've already kind of been through the ringer of musculoskeletal health care, not gotten the results you're looking for. Maybe you've had medications, injections, multiple rounds of therapies or whatever, and you still got pain. Maybe this can help shift you in a mental space of maybe what needs to happen next to get you where you want to go. Or if you're a clinician and you're struggling to get patients pain-free, or you're just looking for new ways to do things different or do things better, then maybe there's some little nuggets in here that you can take away. But, I think that the best place to start is a full body screen. And we do this with every patient that comes through the door. And why we do that will become really important as we kind of move down the list of things that help us navigate the pain cycle. And I started doing this when I started treating one-on-one. So when I was working at the corporate center, seeing a whole lot more patients a day, I remember my evals being very, very long. So, somebody would come in with shoulder pain and we spend an hour just looking at their shoulder. And looking back now, a lot of that stuff was really arbitrary and irrelevant. Special testing and muscle testing and range of motion testing and getting your goniometer out and seeing exactly what the degree is. I recognize there's some level of importance there for insurance reimbursement, but the level of importance that has for the patient's really nothing. So, the full body screen is the most important, because if you don't understand what the whole body is doing, you cannot help your patients navigate how they need to change their movements or what movements are facilitating the problems that they have. And so even in the shoulder, the ankle becomes important, especially if people are doing higher levels of movement. So when we're thinking about Olympic lifting athletes, CrossFit athletes, the ankles are very important for the shoulder. And we'll talk about that here in a little bit. But even for somebody who's just working around the house, squatting down, bending over, picking stuff up, lifting stuff over their head, just some good old-fashioned manual labor, these things become very important. And so we always check every joint, because if some joint is not working well, that is what creates compensations in the body. And really, almost all compensations happen at the spine or affect the spine in some way. And then the spine affects pretty much everything that attaches to it, which is everything. So everything is important. So we always do a full body screen. We start at the feet and we work our way up. So I remember, taking an hour to assess the shoulder. And now, we assess the whole body in 3 minutes. It just doesn't take long, because we really want to get to the important stuff for people, which is, what's the solution? What's the path that we can take to help you get you where you need to go? Movement is very important. So we're going to get them up and watch how they move, and then kind of trace that back to people's habits that create the stiffnesses that we're seeing in their joints, so we can help them change the habit, change the mobility over time, change the way they move, and ultimately change the way they feel. So we screen the whole body. We start at the feet. We work our way up, and we test every joint to see a couple of basic things. We're not checking range of motion and tracking the numbers. We just know in our minds what somebody needs to be considered like you have enough range of motion. And this is different for everybody, because a CrossFit athlete or an Olympic lifting athlete really requires more range of motion in a lot of places than somebody who's just working out in the yard. And so there are some level of subjectivity here, but the basic is, does your joint move enough? Yes or no? If the answer is no, you have to turn it into a yes. And then are your joints asymmetric? Because if people are doing very symmetric movements like a squat on top of asymmetric joints, you get a lot of compensation that adds a lot of stress in a lot of different areas. And that's where we can start to really affect people's pain with just some simple movement cueing before we even work on joints or muscles or do any of the therapy type stuff. So full body screen, very important. After we do our full body screen, we use a joint first approach. And here's why. And this is just what we have found over the last 4 or 5 years to be really effective. And that is, if a joint is not working well, the muscles around it don't work well. And so checking the full body allows you to understand what all joints are not working well. And then you can start to feed that into whatever the pain side is. So like the knee, for example, the muscles that attach to and around the knee also attach to and around the hip and the pelvis, or to the ankle, the lower leg. And so the knee itself might be moving really well and the joint mechanics might be fine. But if the ankle joint mechanics and the hip joint mechanics, or either one of them or both, if they're not working very well, they can add a lot of stress into the knee because all the muscles that attach there are on tension and working too much to kind of stabilize or mitigate whatever's going on. So just taking the joint first approach allows us to add a lot of range of motion back into the system with not very much work. And we're not talking about flexibility here. And the way we kind of communicate this to patients is if your joint is stiff, you can't stretch your way out of that. Okay, so stretching is for muscles, mobilizing is for joints. All right, so that's where we communicate with patients like, look, you can't stretch your way out of a joint problem. You also can't move your way out of a joint problem. You can't exercise your way out of a joint problem. And if you're, on the other side of this thing thinking, well, yeah, I can exercise my way out of a joint problem, chances are you didn't have a joint problem. You had a muscular problem, because movement can solve muscle problems, but it cannot solve joint problems. If a joint is stiff, it's stiff. And there's no movement that you can do that's going to unstiffen the joint. So, but taking a joint first approach allows you to loosen the joint. And when you do that, the response that the muscles have most of the time is they just relax and let go. You can almost reset and restore normal muscle length tension relationships just by restoring a little bit of joint mechanics. And so, for example, in the hip, if somebody's missing a lot of external rotation, doing a hip capsule mobilization for external rotation, one, allows the hip to move a lot more within just 2 or 3 minutes. It also relaxes out the hamstrings, which can have a very large impact on the knee if somebody's got knee pain. Or it relaxes out the hip in a way that also facilitates a reduction in low back pain. So there are a lot of these different go-betweens. And if you don't know your anatomy and understand how the body's knit together, it can be really hard to conceptualize how doing some of this stuff will work. But joint first approach, we always target stiff joints first, and we always target all of them. So we don't really, and it might take us 2 or 3 visits to work through all the joints. But the point is, if somebody has pain at the shoulder or pain at the knee, making 1-degree shifts in every joint that is stiff will have a massive impact on the pain site. And that is the 1-degree physio. That's the thing that we push, the tiny changes and the massive results that come from 1-degree shifts at all the things that aren't working well. And the thing you have to understand for that to make sense is that pain is not the indicator. Pain is a lagging indicator. It shows up after the problem has been going on for a long time. Pain is the wrong thing to treat. It's the wrong thing to chase. You have to chase the missing pieces. And if people are missing range of motion in their joints or their muscles are stiff because of the joints and their movement looks terrible, those are the root causes of the pain that they have. And so you have to focus your attention there if you want to get pain relief really quick. We get pain relief for our patients in 3 visits or less almost all the time. And really, we don't do that much work at the pain site. We're focusing on these other things that feed into the problem. And in doing that, we can minimize pain really quickly. So we take a joint first approach because we restore range of motion really quick. We unlock the muscles. It frees the body up to do functional movement and respond to coaching and cueing in a much more powerful way. And then maybe the biggest thing we do is when we mobilize a joint or do some trigger point work in a muscle, that is in question, we always give our patients our protocol that we call loosen, lengthen, load. And this is the home program. Our home programs are based on the same approach we take in the clinic. We don't give people arbitrary sets and reps of exercises that don't mean anything. We teach patients how to mobilize their own joint in the same way or similar to how we do in the clinic. We teach them how to target their own muscular stiffnesses and pain points that go along with those mobilizations. We lengthen the muscles around it, and then we load it into a functional movement. So loosen the joint, lengthen the muscle around it, load it into a functional position. And you have to understand, stretching a joint or stretching a muscle by itself will have a transient result. It'll feel good for a minute, but it will go right back where it came from. The body learns through movement. And if you don't use the new motion and mobility that you create intentionally and frequently and consistently, your body will not keep it. And I can't tell you how many patients come in and they say, well, I stretch so much and it's like I'm starting over every day. Stretching is a non-functional thing. Okay, so like stretching the hamstring is a non-functional position. And then people wonder why they can't squat better or deadlift better. It's because they're isolating a muscle when nothing is isolated in movement. Everything is compound, everything is working together, and everything is working at the same time. And so when we do loosen, lengthen, load, it's we loosen the joint so that the joint mechanics allow greater degrees of motion or better motion, more motion with less pain. We loosen the muscles around that to facilitate the change in the joint and show the body there's a new relationship here between the joint position and the muscle tension that's associated with it. And then we cue that into a functional movement. So we want people to move really well inside their new range of motion that we created with no compensations. And we want them to do it over and over and over and over and over. Because when you create new motion and you show your brain there's a new relationship between the muscle and the joint, and then you use it, you get to keep it. But if you don't use it, you lose it. And that's the age-old saying that rings true for everything in rehab. But the key to this is you got to understand is the body always responds to frequency and consistency. You never get good at things that you only do once, or you do it a lot one day and then don't do it again for another month or 2 months or 3 months. The body gets really good at things that you do, even in small doses, but you do them every single day and you do a lot of reps every day, right? So that's loosen, lengthen, load. We give people these little 10 to 12 minute protocols that work the joints at the pain side, above the pain side, below the pain side, or other joints that we find that are sticky in our full body screen. And we teach them how to incorporate this in their daily life or on the front end of their movement routines, whether that be lifting or running or yoga or whatever. It doesn't matter. We teach people how to habit stack this stuff on top of the routines they already have. And that may be one of the bigger keys to how we get pain relief is we provide programs that create a massive result in 10 or 12 minutes. Most people can fit 10 or 12 minutes inside of their day, but what we have found is that if you have a 30 or 40 minute home program and somebody only has 20 minutes to spare, they do 0 minutes of their home program. So we keep it short and we always habit stack it on top of something that we know they're already going to be doing every day. And that's how we create stickiness around our program so that people adhere to them and stick to them. And if they do them for 7 days straight, they see a massive change. And then it's just kind of this catalyst to keep going and keep doing it because they know every time I do this, I'm going to get a little bit better and feel a lot better every time I do it. So, as therapists, they always preach in school and in the clinic, check the joints above and below. Or work the joints above and below. And I'm going to demystify some things around that because some of that stuff gets lost in translation. So you got to know how the body's knit together and how things work together functionally. Like the knee is just a big, robust joint caught between a really mobile hip and a really mobile ankle. And so if a really mobile joint becomes less mobile, the really stable joints that are caught between start to become like unstable, right? So the knee gets forced into positions that it shouldn't be in when the hip and the ankle don't function like they're supposed to. But just providing clamshells at the hip and ankle stretching or calf raises below is not going to change how the knee moves. You have to change the joint mechanics so you can change the movement mechanics, right? So if somebody his knee is like crashing in when they squat, you need to free the hip up to move into external rotation, and you need to free the ankle up, the triplanar motion of the ankle, so that the knee can track in a new direction. As long as the ankle is stiff and the hip is stiff, the knee is going to crash in because that's the only place it has to go. The body always follows the path of least resistance. So when we mobilize into a resisted position, and we do that enough times until the position no longer has resistance there, and people can easily move into better positions inside of their functional movement. And so above and below is really important for pain relief early. And that means not just providing exercise above and below. You have to mobilize the joints above and below and make sure their movement mechanics are pristine or close to it, or at least incrementally moving in the right direction. You're not going to restore full joint mechanics overnight. Joints are big, robust tissues, and they're stiff, and they just take time and consistency. And that's why we provide these things for people to do at home. It's because seeing me in the clinic every day is great. But 10 minutes a day on your own every single day of the week, the effect in just 7 days is really profound. But take that 7 days and turn it into 70 days, and what's the result? And turn that 70 into 700, and what's the result? And you could, like these like ordinary things done for extraordinary lengths of time, start to stack up into these really big results when you can just do the tiny things over and over and over again. And so working above and below becomes very important, and we teach our patients how to do that. But then, we have to expand outside of that. A lot of therapists, maybe they do a great job of looking above and below and seeing what's deficient, but then understanding how joints outside of that, so the joints above what is above and the joints below what is below, and how those affect functional movement. Because you got to know, like, the way people move is ultimately going to control how they feel. And how people move is controlled by how their joints move. And how people's joints move is controlled by largely the time they spend during the day doing certain things, their habits, right? So if somebody sits all day, we can know a couple of things are going to be really stiff. Their hips are going to be stiff, their knees are going to be stiff, their ankles are going to be stiff, and their shoulders are going to be stiff. And that's dang near all the joints that are important. So understanding how ankle stiffness affects shoulder pain is really important for functional movement, because when the ankle doesn't move, it verticalizes the shin, it lowers the torso angle, and then if you're doing anything overhead while squatting, it's going to force internal rotation of the shoulder to maintain center of gravity. And so there's just some things you need to know how the body's knit together to solve the bigger problems around functional movement. Because if somebody's shoulder hurts and they're trying to do overhead squats on a stuck ankle, their shoulder is going to hurt no matter how much mobilizations or dry needling or scraping or stretching or whatever you do at the shoulder, because the movement is the problem and the compensation is the problem. And sometimes the global functional mobility in compensation is caused by a joint that is far outside of the pain site, and you just have to know how that stuff works. But ultimately, this is how we help our patients navigate these mobilizations, and how we're going to systematically get them there is by teaching them how the ankle affects the shoulder, and how the ankle affects the knee, and how the hip affects the knee, and how the hip affects the shoulder, and how the pelvis affects the shoulder. There's a lot of things that go into it, and you can't know that unless you're doing the full body screen to start, and unless you're comfortable doing the full body screen and starting to tinker with all the joints at the same time to see how it affects the pain site. But we've been doing this for 4 years, full body screen, every patient. We start working on as many joints as possible, as quickly as possible, in achieving pain relief in 3 visits or less. And so it's been working really well. Maybe we stumbled upon that, but good for us. Now we help a lot of people who have had pain for weeks, months, or decades, who've been to lots of different places and they're still struggling. And then we get them pain reduction really fast. And so that's a great thing for them. And we think we can pass this on to other patients with other therapists. But it takes a little broader scope of treatment and understanding what's going on in the body. I know this becomes challenging, like in an in-network setting. You can only work the joint that has been prescribed, which is really stupid and annoying. And so there are some limitations there, but just understanding and maybe sliding some stuff into a home program that could help your patients is better than just saying, oh, well, I can only treat one joint, and then you just treat one joint. You're doing a disservice to yourself and your patients. So figure it out, figure out how to integrate it in, even though insurance is going to create problems around that and be like a thorn in your side no matter what. And then the other thing that we really communicate with patients is how we think about pain. And this goes back to some other videos we did, about like the 211 to 212, the boiling water. But really the thing we communicate to patients is, look, pain is a part of the human experience. It doesn't mean you have to be stuck with it. It doesn't mean you have to always run off to see a professional to help you solve those problems, but it does mean you need to understand what pain is and why it's there. Pain is a lagging indicator that shows up after you've had a problem for a while. Okay, so trying to solve the pain is just like trying to, like, your transmission light comes on in the car, and you just turn the light off and you never address the transmission, right? So for patients, we're always communicating like, look, you're going to have pain. It's going to come and go. If you're going to do stuff and be physical and do things in your life that require you to move your body, stuff's going to happen. But knowing what to do is the key to pain freedom. Okay, it's not being free from the experience of pain. It's being free from being trapped by your pain. And so pain relief and pain freedom are not the same thing. Pain relief is actually minimizing and getting rid of pain. But pain freedom is understanding how to take care of yourself so that when pain starts to come on, you're not stuck in it or trapped under it. You know what to do to minimize it on your own, and you know how your body works in a way that you can start to resolve these things on your own and take a big crack at solving the pain problem by yourself before you go see somebody. Then certainly, like if you're doing all the things that you should be doing and you can't get rid of it, go seek some help from a professional who can help kind of look outside the box and see what's going on. But we always teach our patients, how does the body work? How do you take care of yourself? How do you mobilize your own joints? How do you do your own trigger point therapy? How do you recognize where pain is coming from? Because a lot of times, like, muscular pain sends pain somewhere else. It's not just right where the problem is. And so we teach patients that so they can really take independence in self-care to the next level. And the other thing is, like, look, you need to stop thinking about pain as, are you making progress or not? If you have pain or no pain should not be your indicator of if you're making progress or getting better. How we communicate that is like, look, if you know your joint should move to this position and it doesn't, then you just need to keep working on it until it does. Okay, you can't expect to have total pain relief if your body is still stuck in less than optimum positions or has less than optimum motion available, especially if you're doing movements that require that. And so we're always kind of reiterating this idea of, hey, look, pain is going to come and go, and that's okay. We're going to teach you how to manage it and take care of it on your own. And we know it can be frustrating to have pain for periods of time that extend past what you wish you had them for. Nobody wants pain, and nobody wants to have it for longer periods of time. But the truth is, you just have to know, you just have to keep making the 1 degree shifts until you get all your motion back. All right. And if you get all your motion back and your movement looks really great and you still got a problem, that's when we're thinking maybe we need a referral because something structurally has happened that is causing you to have pain. That's a different conversation about, when should you see the surgeon and when should you have surgery? And maybe we'll talk about that later. But really the idea is, hey, you got to understand how the full body works. Taking a joint first approach will unlock the muscles and allow better movement and will create less pain. Following really short, simple protocols to help patients achieve the result they need at the joint, above and below, or at the pain site, and then understanding how functional mobility and compensation affects a pain site. Those are all ways that we start to feed into patients and start coaching and cueing, where we can have them move just a little differently, start working on their joints on their own in a really frequent and consistent basis. And, 3 visits for us is 3 weeks. And the amount of change our patients experience in 3 weeks is pretty drastic because of the things that we give them to do at home that are really focused and really intentional around restoring joint mechanics and restoring movement mechanics, teaching them how to move well inside their current boundaries of movement, right? So, squatting past parallel is great, not necessary, but it's great. And if that's your goal, we want to help you get there. But you can't sacrifice your spine and your knees and your feet for the sake of squatting parallel or past if your body doesn't have the prerequisite mobility to do that. So we're just teaching patients, what are your boundaries? How do you find them? And then move inside of those. Our home programs help change the boundaries. The boundaries are joint limitations that don't allow you to move past a certain point without compensating. We teach, what is that point? Work inside of that, but then always explore new range of motion as you're working the loosen, lengthen, load protocols, so that as new motion improves, your body is improving with it, and you are experiencing new boundaries of movement until you reach your goal, which might be, butt to the heels squat, which is a great goal to have. We're not going to tell anybody what their goal should be. But the idea is just like, hey, we're going to work until we get to where you want to go, and until you have enough mobility to live your life the way you want to live it, without really having to be anxious about, am I doing too much, or am I doing this wrong? When people leave energy, they're totally comfortable and confident in what they're doing, and they should be able to walk into any gym and do any movement they want and understand how to move their body inside of its own boundaries and how to change those boundaries over time. And so that is how we think about pain, and that's really what helps us navigate the pain early on, but it's also how we help people navigate pain when it lingers, right? If people who have pain that extends past the 3 visits, this conversation comes up a lot because it's really frustrating. But we want to always double back on, hey, look, pain is not our measure of progress. Our measure of progress is, are your joints moving better? Are your muscles functioning better? Is your movement looking more and more like the target? And if it is, you just need to keep chipping away at it until you get the desired result. Because like the boiling water, the big thing happens from 211 degrees to 212 degrees. But every degree was important to get from 200 to 211, and then bam, the magic happens at 212. So you just got to keep taking the 1 degree shifts, and eventually the magic happens. You're going to wake up and think, wow, I'm moving better, I'm feeling better, I'm managing my own pain. I don't have pain, and when it comes up, I know what to do with it. And that's really what we're trying to do. So if you're a therapist and you're trying to figure out, man, how can I get next level results with my patients, or how can I get pain relief faster, take a broader approach to therapy. If you can, figure out how to, skirt the boundaries of the insurance problems that they create with, treating a single joint referral site. But really spending 2 minutes on joint mobilizations at the hip and 2 minutes on joint mobilizations at the ankle have a massive impact on the low back and the knee. And so figuring out a way to blend this stuff in can help you get better results for your patients in a shorter time frame. Especially when, like, you're in a clinic and you're seeing 3 or 4 patients an hour, and maybe all you have is 15 minutes of one-on-one time with your patients. Spending those 15 minutes doing really focused and intentional joint work will make them feel better and move better inside their home program, even if you don't have like a lot of time to coach and cue them yourself. Like if you give the body the ability to move better, a lot of times it will without the coaching and the cueing. And, you can use that to your advantage if you're in a situation where you're having to pass your patients off to a tech to work through their exercise program. Better yet, spend an hour a week with your techs teaching them what movement should look and feel like so they can communicate that really effectively to the patients, right? I mean, a monkey could do this stuff. Well, you just have to teach them English first. So don't think you can't teach this stuff to a tech. Don't be frustrated in the fact that you have to pass this person off and you can't do the coaching and cueing yourself, because there's no reason why you can't teach the other personnel at the clinic how to communicate this stuff and watch patients move and teach them how to move correctly and use verbal and physical cues to help them get in better positions, how to spot movement and efficiencies. Okay, if we can teach CrossFit coaches and personal trainers and strength and conditioning coaches how to manage and monitor this stuff, there's no reason why we can't teach our therapy techs in the clinic how to watch and monitor this stuff, because they're going to see it over and over and over again. There's a big opportunity for teaching and getting really proficient at doing this stuff. So don't use that as a cop-out. Use it as a way to improve your patient experience, even in an environment where it's really hard to deliver one-on-one care and be really focused and intentional with just about anything. And I can say that with confidence because I lived that life for 5 years before I jumped into energy. So hope you pulled some nuggets out of that. If you're a patient and you got questions, maybe wondering, hey, here's what's going on, where can I go from here? Happy to help you out. You can always email me at chad@nrgphysio.com. Let's do that right here, chad@nrgphysio.com. A lot of people think it's energy. It's actually NRG. And here's my email. Got any questions, you can email me, no problem. You could always schedule with us right here. energyphysio.jnap.com, select initial evaluation. If you're seeing this and you want to come talk to us, we'll do that for nothing. We'll just help you out. No problem at all. So if you got questions, reach out. If you're a clinician and you got questions, reach out. We're trying to improve the patient experience. We're trying to improve how well you can get your patients better in a faster amount of time. So if you want to talk a little bit about something you heard, we're happy to chat through that and help you out. And until next time, we'll see you later.